think we're on. Happy Tuesday, loves. So sorry that I missed you last week, Thursday. I apologize about that, but we are back. So, if this is your first time checking out one of my live videos, thank you for joining me. And my name is Dani LaBerry. I'm a licensed psychotherapist and a happiness transformation coach. So, I typically work with people who are feeling unfulfilled, overwhelmed, stressed out, anxious, depressed. So, in case you were unaware, the month of July is National Minority Mental Health Awareness Month. And in case you're like, Dani, where'd you come up with that? Or where did that come from? That's from the U.S. Department of Health and Human Services, as well as NAMI, which is the National Alliance on Mental Illness. So, for tonight's Facebook Live, I wanted to talk about the importance of minority mental health awareness. And I know that there's a lot going on. Let me just start with that. And in case also, I notice I say in case a lot, but just in case you're kind of wondering if you've been following me or following my content for some time for some time now and wondering, hey, Dani, you kind of just took us left field here because I usually work with people who suffer from addiction or are feeling unhappy. So I wanted to talk about access, and I also wanted to discuss some of the things that's going on as far as human behavior, as far as people. There's a lot of suppression that's gone on in the past, just culturally, society, just socially speaking and society speaking. So there's a lot. And I don't want to go on and on and on. I want to keep it in a nutshell. It's usually what I try to do in these Facebook Lives. So we're going to start with a little bit of statistics. African American adults are 20% more likely to report serious psychological distress than Caucasian adults. That's from a statistic from Mental Health America, mhanational.org. Another statistic is that older Asian American women have the highest suicide rate of all women who are 65 plus years old in the US. That's from the Office of Minority Health. Adults with disabilities are 3 times more likely to commit suicide than peers without disabilities. That's from the Disability Rights Education. Gay and bisexual men have higher prevalence of eating and body image disorders than heterosexual peers. That's from the National Eating Disorder Association. So, why am I saying all of this? I'm saying all of this because individuals in poverty are more likely to be exposed to complex trauma and less likely to receive quality mental health services. So, what affects someone reaching out for mental health services? What are some of the things that get in the way? Cultural differences. So even culturally speaking, and when I say what I'm about to say, I don't mean this in some sort of way to stereotype or just segregate anyone. This information that I'm getting, and that's why I'm being very careful to cite where I'm getting all my information. These aren't opinions of me, whether I'm liberal or conservative or anything like that. I wanted to be as factual in this live as I could be because I know there's a lot going on. Latin populations tend to view mental illness as a health or medical issue, focusing on physical complaints. So, for example, stomach aches or body pain. Translation issues. In Korean populations, depression and anger can be described as a burning fireball in the back of someone's head. So they're more likely to seek treatment from, say, medical professional, or a primary care physician, for example, rather than a mental health professional. Stigma and discrimination within the community also affects people from reaching out for help or seeking mental health services. Mental Health America conducted a survey and found that 63% of African Americans believe that depression is a personal weakness. So this starts to go into the biggest reason why I wanted to do this live. A lot of cultures across the board operate on stoicism and emotional restriction, or what I like to call suppression. So therefore, individuals may be hesitant to seek out help they need because they've just been culturally, socially trained not to. You don't feel feelings. Boys don't cry. I think I talked a little bit about this in last month's Facebook Live. If we're raised in a culture to just suppress our emotions and not address them, talk about them, acknowledge them, and feel them, it's going to come out in our behavior. It's going to come out through violence. It's going to come out through poor decisions. It's going to come out through impulsive decisions or lack of impulse. So my point here, my intention is to raise awareness. To raise awareness, not just, usually I raise awareness on substance abuse and addiction. That's what I've been doing for the last few years now. But I'm also wanting to raise awareness on mental health too. It affects individuals of all races, ages, socioeconomic status, gender, sexual orientation. It doesn't make a difference. It can affect anyone. And so if you've been noticing that you're feeling irritated, you're feeling snappy, you're noticing that you can't maintain relationships, healthy relationships, you don't have a very good support system, you notice that maybe in order to cope with your emotions, you're drinking or you're overeating, notice that you're feeling tired all the time, you're having a hard time dealing with anxiety or stress, reach out. It does not make you a weak person. It actually makes you a stronger person, because it takes a lot of courage to say, hey, you know what? I'm feeling this way. I have a problem and I need to address it. It takes a lot more courage to do that. So I wanted to leave you with some resources. I didn't want to just leave you hanging here. And I want you to, if this is something that interests you, check it out. Or, as I always try to encourage people, is share. If you can share my video with friends, loved ones, anyone who needs access to this information. MHAnational.org, that is Mental Health America. They have something called BEAM, Black Emotional and Mental Health, is a training, movement building, and grant making organization dedicated to the healing, wellness, and liberation of Black communities. That's actually quoted from their site, so I don't want you to think I wrote that. That's how they consider their organization as. Office of Minority Health, U.S. Department of Health and Human Services. And to access them, it's minorityhealth.hhs.gov. And of course, where did I come up with that July is the National Minority Mental Health Awareness Month? NAMI. So National Alliance on Mental Illness. And I hope that this information was helpful. Like I said earlier, if you found that it was helpful, please feel free to share it. Again, my name is Dani LeBerry. Thank you so much for checking out my Facebook Live. If you have any questions or anything else came up for you, please feel free to contact me. My email address is Dani, D-A-N-I, @DaniLeBerry.com. Thanks again for watching, and have a great rest of your night. Bye.